What about smoking? You'd have to come from another planet not to understand the debilitating effects of smoking on health. 7-year-olds will come home from school and tell you why you should not be smoking. So we get it, we understand it. Well, if we get it and we understand it, then the smoking rate should have plummeted and stayed down. And they have, principally for one group and one group only. And that group is Caucasian males who wear ties. That's the only group that substantially cut smoking rates and had it stay down. For everybody else, the rates went down and they went back up again. We have more teenage girls smoking today than in 1960. Is that because we don't understand about tobacco? No, we understand about tobacco. Something's gotten in the way. We've looked at this something that's gotten in the way for about the last 5 years. And we worked with different groups, wellness groups, rehab groups, to find out what it could possibly be. And our conclusion is what gets in the way for a lot of Americans is daily chronic stress. In fact, 89% of Americans say, I've got way too much stress in my life. And the interesting thing is, when we talk to people and we worked with them on this issue, it wasn't the big ticket items that got in the way. Hardly anybody here is stressed about Iraq. And I can tell you, we're concerned about our 401ks, but nobody's quite stressed about it yet. I'll tell you why we're stressed. Everybody in this country is out of time. Nobody has enough time to do anything, all the things that they want to do. We're multitasking, we're pulled in different directions, we're working longer hours, we're trying to fit it all in. I talked to a female engineer at the Boeing company the other day where I do some consulting, and she said to me, let me tell you about my life. I'm answering emails at 9 o'clock at night. I'm doing laundry at midnight. I'm in a grocery store at 6 a.m., dropping kids at school at 7, punching into Boeing at 8, writing down the 20 things I must do that day to have a successful day. It never happens. She said, so I go through the same thing the following day, but now I've got 10 as a holdover. She said, weekends used to be for kicking back. Now it's for catching up. You do all the things on a weekend that you never got around to. Well, when you're that chronically stressed, okay, when you are chronically stressed, every single day you're feeling that, excuse me, then you can know so much about healthy eating that the food pyramid or the food plate is tattooed on your forehead, but M&Ms are lunch. When you're under stress, all roads lead to the refrigerator. When you're under stress, you don't go to the gym and exercise. When you're under stress, you light up cigarettes. So what we're concluding is that this is a big ticket item, every bit as big as diet and exercise. And the key question we need to be looking at today is, it's less about the specifics of diet and exercise and more about getting people to put the information to work. And what we've found in the groups that we've worked with is, if you can get people to manage their stress, they manage their diet and exercise. If they do not manage their stress, they talk about managing their diet and exercise. They just never get around to it. So, with that being the premise, I would suggest to you 3 things that we would want to consider with this issue. The first is, we really need to define the goal. And I think for most of your employees, the goal would be probably less stress. In fact, let me ask the question. How many people here would like to have less stress in their lives? Okay. How many people here would like to hit lotto? I think your chances for one are every bit as good as the other. I do not believe in stress reduction. I think it's an oxymoron. I don't think there's anything I could teach you this morning that would allow you to get up tomorrow morning with less stress in your life. It just simply doesn't work that way. I think life goes on, there's stress. The opportunity, the goal should be not stress reduction, but stress management. How do we handle the stress that's in our life more effectively? How do we handle the stress in our life more efficiently? That's where it comes in. I do a lot of wellness programs, work with companies that have wellness programs, that do community wellness programs. And consistently, if we do an entrance questionnaire for a group of people, and they'll say, gee, 89, 95% will say I have too much stress in my life, and a significant percentage will say, and it's hard for me to cope with it. And at the end of the program, when you ask the exit interview, you still have 95% that says I have too much stress in my life, but those numbers for how many people have difficulty coping with it fall dramatically. So that's what we're looking for. So that's the goal. Well, if that's the goal, then we ought to figure out where are the sources of stress? Where is the stress coming from? And there are two principal sources. The first is called external stress, otherwise known as significant life events. So these are the big ticket items in life: marriage, divorce, birth, death, moves to a new home, changes in financial position. Death of a spouse is the single most stressful event that anyone will ever experience. The death rate for widows and widowers the first 6 months after the death of a spouse excuse me, is at an all-time high. So what we find is that when there are too many big ticket items going on in too concentrated a period of time, that this raises the stress level significantly, and that stress level has an impact on whether or not we adhere to healthy dietary and exercise habits. So the second source of stress is probably even more important. It's internal. It is otherwise known as type A personality. Now you know type A's. We're the guys with hurry sickness. We move our watches ahead to make us think we're going to be late, so we'll always be on time. Okay? We are so impatient that we will finish sentences for you. And here's a simple test that we can take to see if you have some type A tendencies. Just answer this question. When you're on the freeway, have you ever driven in anything other than the left-hand lane? I had one guy say, yeah, I get up on the shoulder as much as possible. He's a double A. But we have characteristics for type A's. We're the high achievers. We're the workaholics. We chop the wood. We haul the water. We do it all. But we do it with a tremendous time urgency. And that time urgency is always in the back of our mind. If you have a woman that does a project perfectly in 8 hours, if she's a type A, she's not happy. Because she thinks, I should have done 2 projects perfectly in 6 hours. There's always that time urgency. We feel guilty doing nothing. Type A's climb into a hammock on a weekend only with a briefcase. You've got to be doing something all of the time. Time is too important not to be productive. We love numbers. Show a Michelangelo painting to a type A. His first question, what's it worth? What are the numbers? How much of this? How much of that? We describe ourselves in numbers, our work in numbers, our company in numbers, our family in numbers. We do not delegate, and this is a real shortcoming. Type A's don't delegate because they don't trust that anybody else in the world can do their job exactly the way they do it. And they know that nobody could actually be trained to do their job exactly the way they do it. So they hold on to it all, and it really limits your ability to maneuver. And finally, they're extremely competitive. I tell my friends in the cardiac rehab business, watch out for fun runs, because heart patients will kill for a t-shirt. Okay? Here's a classic characteristic for type A males. Type A males always play games to win, even when playing with children. You're in your backyard, you're playing croquet with your 11-year-old daughter, you hit her ball. Do you ever go mallet head away? No, you drive her to Dallas. My goodness, you're going to show that child. Tell you a story about type A's, and then we're going to take a little survey to see if you might have some type A tendencies. I have 2 children. They're grown now. They have their own families, but they grew up in the Seattle area. We live in a place called Gig Harbor, and they grew up playing soccer. I'm sure it's the same for the kids here in Texas. Everybody plays youth soccer. So when my daughter was about 14, she was chosen for an all-girls team that went to play for a month in Germany. So we, washed cars, collected newspapers, wrote checks, did whatever we had to do. These kids went over. They had a marvelous time. And then they came home, and the German girls came here. So we were host in our home for 1 week to 2 14-year-old German girls, soccer players. Now, they're going to play a lot of soccer, but you also want to show them the area of the world where you live. And my wife said, these kids are not going back to the Harz Mountains of Germany without seeing the Pacific Ocean. I said, that's no big deal. We live in Gig Harbor. It's a harbor. And the water in that harbor is connected directly to the Pacific Ocean. She wasn't buying it. So my fallback position was, okay, let's take him out to the Washington coast. It's about an hour, 15-minute drive for me. We've got the beaches and the big rollers, and they can walk on the beach, and it'll be just perfect. She then informed me that in her opinion, which of course rapidly became my opinion, that the Washington coast was not the true Pacific Ocean. She wants to bring these kids to the coast of Oregon. Now, I don't know if anybody here has ever had the great good fortune to drive Highway 101 down the coast of Oregon, but it is just the most fabulous countryside. They've got wonderful beaches, crashing waves, whales, sea lions, rock sculptures that come out of the water for 2, 3, 4 stories, trees that are a couple of 100 feet tall, everything's green, everything's blue. It's just terrific. She wants to take these kids to Cannon Beach, Oregon. Now the problem is, Cannon Beach is a 3.5-hour drive for me, and I have 1 day to do it. So I agreed, okay, we're going to Cannon Beach, load up the car, but as a Type A, what do I say to myself? 3.5 hours? No way. 2 hours, 40 minutes max. So I am out busily breaking the land speed record. I look in the rearview mirror, there's a red light pulling me over. Trooper comes to the window, he says, how long since your last ticket? I said, about 5 years. He said, well, you're going too fast, and he wrote me out a ticket. Now any sane person, any Type B personality would say, we got a ticket for speeding, let's limp into Cannon Beach. When we get there, don't worry about it. What's a Type A say? That guy made me late. I'm off schedule. What do you do to get back on schedule? You go faster. I did. 20 minutes later, rear view mirror, red light from the other. Now I happen to glance into the back seat where I've got 4 children. There's my 14-year-old daughter who would like to be dropped off at the nearest nunnery. Life is over. There are the 2 German girls who have actually seen this before on a rerun of Miami Vice. And there is my then 11-year-old son who thinks this is the greatest thing to happen to an 11-year-old boy in the history of 11-year-old boy. He is so happy to be sharing this experience with his dad. I can hardly keep him out of the front seat. Well, the trooper comes to the window. What's his first question? How long since your last ticket? And my son never misses a beat. He says, well, actually, officer, not all that long. So if you identify with that, you know what I'm talking about. Okay, now we want to see what tendency you have. And so I'd like you to go to the handout that was passed around and go to the last page. And what we have is a little Type A test. And I've got a range there from 3 to 24, depending on how strongly you feel one way or the other, along with some diametrically opposed descriptions. So let's drop down to the bottom. The one extreme, you're casual about appointments, if you're 10 minutes late for lunch or 15 minutes late for a meeting, no big deal, things can get started when you get there. If that's you, you're at 3, you're at 6, you're at 9. The other extreme, you are never, ever, ever late. You would drive your car through a brick wall rather than be late for a doctor's appointment. If that's you, it's 24, 21, 18. I'll give you a minute, work your way down through those diametrically opposed descriptions and see if you're on either extreme or in the middle, and then add them up.